We will now move things over to our next innovation presentation. So we would welcome our next presenters who will be discussing a program that they have implemented. So we have Soni Manpreet Singh, who is the Integrated Care Manager with CHATS, and we have Ami Sheth, who is from Southlake Regional as a Project Manager. So I'll turn that over to both of you.
Great, thank you. Everyone, my name is Soni Singh, and I'm the Integrated Care Manager at CHATS. And part of my role in this position is to provide operational oversight of all integrated care initiatives across the OHTs and within our geographic area. Thank you for having us come to present today at this conference to provide you some insight on some of the initiatives that CHATS has been a part of in this past year, particularly working with Southlake Community OHT. At this time, I would like to invite my co-presenter, Ami, to introduce herself.
Thank you so much, Soni, and thank you to the conference host for providing us this opportunity to present today about some of the innovative partnerships and collaborations we've had established at Southlake Community OHT. My name is Ami. I'm the project manager at Southlake Community OHT, working with Gail Seddon, as you all may have come across work with her in the past. We would like today to talk about an alternate level of care rate problem or a systemic problem, and give you a snapshot of what the systemic problem is, what it looks like current day, and how we plan to tackle it through the community collaborations with the different sectors, including the community support sector. If you, this is just a snapshot from August, from the month of August, of the number of patients who are waiting for a bed or designated as an ALC patient. The rate right now is about 24%, and most of them are waiting, a majority of them are waiting for a home with service and home with home care service. So we looked at the systemic problem and understood and figured out how to sort of tackle this problem with our partners, not just acute care, but also the community support sector, the long-term care, and the mental health sector, and to look at how to review the transitions of these patients. What are the barriers, and how can we overcome the barriers? To do so, we developed first the governance for it, the Southlake Community OHT governance, where, as you all know, to move any initiative, we actually need a lot of engagement with the leaders. So to establish a collaborative governance between all of the sector providers, we've got the board, we've got the sector tables, where we've got a community support sector table right here, providing a lot of governance and a lot of support, both at the board level as well as at the operational level. And right now we've listed some of our projects here, where again, community support providers are front and centered in the operations of it. Through the board, through the operations committee, we also did review the senior friendly care guidelines and actually completed the self-assessment to look at the strengths, to look at the weaknesses, and also to look at all the gaps in our assessment. And based on the gaps, based on the strengths we have, based on the leadership and the engagement that we've developed, we've sort of developed 8 targeted actions, right from the proactive identification of the clients to how, once they're admitted, how to transition them into the community as fast and as soon as possible. So we developed these 8 targeted actions, which are sort of feasible. We also looked at many others, but we focused on what is feasible. How can we build success and then build over and top of it? So we're going to talk about a few of these targeted actions, Soni and myself, during our presentation today. Back to Soni.
Thank you. In context, I just want to discuss how CHATS got involved with this work and why it's so important to us as being a community organization. One is that of our accountability. There's an emerging context as we recognize the value of the role that the community sector plays in ED ALC avoidance, and that with our MSA obligations, that we are working towards improving access and flow by reducing alternative levels of care, participate in and align with regional plans to support admission diversion, maximize capacity, and support patient transitions to the community. As Ami was mentioning, our partnerships with the Ontario Health Teams, CHATS engagement with the OHT work, especially with Southlake, actually started back in 2019 when we became core partners with the Southlake at Home program. When we had first started up this initiative with the hospital, it was through in-kind participation. And at that time, we were just trying to get our feet in the doors. Since then, I can proudly share that CHATS has been part of 6 other hospital-to-home programs in York Region. We're core partners with Southlake, Mackenzie Health, and Oak Valley Hospital. While we're working together with our OHTs to focus through ALC, through collaboration quality improvement plans with a micro focus on ED ALC avoidance through related initiatives. So some of the best practices that we looked at as a community was based on the guidelines that were released in 2021 for community. Next slide, please. So just as Ami was mentioning some of the initiatives that we've put that have been in place, I'm going to be talking about the community resource education. CHATS is now leading and facilitating monthly community resource educations at the hospital for the staff. And I just want to share with you some of the structure and importance and feedback that we've had since there. So the why was really to increase awareness of community resources available for discharge planners, nurses, social workers to assist in discharge planning of patients, ensuring a smooth transition and a successful return back to the community. It was put in place in regards to increasing staff knowledge of the resources in the community as part of our ALC reduction strategies. And it's really a place of gathering of organizations that can support patients, families, and caregivers through their healthcare journey. It was also an opportunity for increasing networking and fostering improved working relationships between hospital and community, with proactively identifying resources when ready for discharge for successful return to the community. What happens in the sessions? So each month there is a 30-minute presentation scheduled when a different community support agency presents their programs and services via Teams portal link. Each organization will present on services that they provide to either highlight overall services that they provide as an agency or on a specific program that they think is useful and beneficial for hospital staff to know to ensure successful discharge. An invite is actually sent out from myself directly to the hospital staff. And these are to individuals that have been identified by the leadership team at the hospital that could benefit from the sessions on what resources are available in their community. The sessions are actually held midday, and that was really based on feedback and the timing of the length of the time of the sessions, from feedback from the staff participating and also from leadership to see what would be the best time for attendance throughout the day. After each session, there is a short Q&A, and after it is completed, the PowerPoint that was presented by the organization and any other supporting documents that they wanted to share are sent out to everyone on the distribution list as a take-home resource and being able to access when needed. There is also a post-evaluation survey that is sent out to all participants after the sessions to get feedback in regards to presentation, the content was there, and also another way of gathering information related to upcoming educations that they may be wanting. The who attends the sessions. It's a full multidisciplinary team that includes managers from all departments in the hospital, some from the at-home programs, the ALC managers, individuals from ED, clinical coordination, GEM nurses, home and community care nurses, basically anybody who's involved in discharge planning, transitions, patients, or caregiver support. The so what. With taking on the lead for the education session for the staff at Southlake, it has been key in giving them the knowledge they need to assist with discharge planning, the confidence to know about what resources are available, and also a key point of networking with others. I just want to share my first experience when I ran this session back almost a year ago, November. It was amazing to hear the positive feedback from participants of being able to learn about community organizations at this platform. But my feedback has always been I became sort of a quick reference person to connecting many individual staff at the hospital and departments and linking them up to community agencies and services. This honestly showcased to me at the first session that how disconnected we are, and if us as community are present, feed them on a silver platter, they will take the information. I would like to say, within less than a year, we have held 9 sessions with different organizations or programs that have been highlighted, and we have had over 80 individuals attend these sessions. Next slide. All right. The next, the other initiative I want to talk about is with us becoming a player at the table in regards to the educations, it has opened up many other doors for collaboration as a team while we continue to serve patients and those individuals in the hospital. So from starting with the education, we are now members and are joining 2 key hospital meetings with lens on how to support community discharge planning. We're actively involved with Southlake around transition, and with the focus being on ALC, the daily ED rounds that are happening were our stepping stones of being around that table. The goal of the ED rounds is really to address leading practices focused on early identification and assessment, care planning and development, and ongoing reassessment, designing senior-friendly care processes, and proactively transitional planning. These rounds are an integral part of the hospital life and now have become a multi-purpose, multi-professional platform with the presence of community agencies. The ER rounds, or ED rounds, are dedicated interventions for patients who come in overnight to ED, and they are reviewed every day. At the time, we're beginning the discharge planning process at admission, and that's where we're identifying any community supports are required upon discharge. We're proactively flagging in the patient's chart for follow-up coordination becomes seamless when patient is ready for discharge to return with services in place. We are really starting the process of a discharge at admission, which is so crucial on identifying the support needs at this time so that a person doesn't become an ALC patient. With having a full roster of care providers at the table discussing each individual in live time, there is an emerging support needed about community service knowledge and awareness, and it's supported by community partners. What happens in the rounds? There are a review of patients, as I mentioned before, that come in overnight in ED and are at risk of becoming ALC. Many a times, these are frail seniors, patients with multiple prior admissions to hospital, individuals with complex health and social care needs that we're really focusing on that are returning back in the hospital. As I mentioned earlier, the ED rounds are held Monday to Friday every day, and with the goal of having a whole team involved with live discussions on how to support this individually. With this piece of the ED rounds, we are now part of actually the weekly ALC complex discharge long stay meetings. Similar to the meetings of the ED that happen daily, these are happening weekly, and where it's set to review patients that have been in hospital for over 30 days and who are at risk of becoming long stay ALC patients. This dedicated time weekly allows for a wholesome discussion for others around the table to try to troubleshoot challenges and work together on individuals for many reasons are not able to be discharged at that time. Some of it due to the complex social development or physical care needs, or have unmanageable behaviors that are barriers at this time. So there is no acceptance into any long-term care or other facility.
Thank you. Sorry about that. And so just to round off the conversation on daily ED rounds as well as complex discharge rounds, so far we've started the pilot last year, and on an average, we've diverted around, on an average, we divert around 10 clients per week from admission due to the participation from home and community care, loft, chat, and the hospital individuals. And in the complex discharge rounds, we've been able to decrease the long stay from approximately 5,000 days to 2,000 days since we started this pilot. So they have been very important in terms of our ALC, in terms of reducing the ALC rate. Obviously not at the very ideal place, but it's a great start to great beginnings and great other initiatives. On that note, we've also have few other transition program, like Sony mentioned, Southlake at Home and Southlake at Home Plus program, started back in 2019. It has been a great program which has been emulated in other jurisdictions to look at how to transition patients from hospital to home. And the beauty about this program is that joint care planning sessions that occur before discharge, midway into the program, and towards the end of the program, of how to sort of transition the patient back into the community and how to support the patients during their rehab journey. So far, we have had absolutely a brilliant patient satisfaction rate. And more than that, we've been able to support on an average about 60 clients per month with this program. Again, to showcase, it's due to the partnership of various support sector tables that has made this program very, very successful, enough that it has been emulated in other jurisdictions. And lastly, we are developing developing one other program where, along with our community partners, the hospital partners, we're looking at a consistent tool to identify at-risk for ALC patient. It's one of the leading practices of identifying at-risk individuals, and looking at a tool to understand how to identify them. And more so, after you identify them, how do you put all the interventions together that are interdisciplinary in nature, intersectoral in nature, to avoid hospital admission. This is at a nascent level, but we've started the journey with our community partners in terms of identifying the tool and then charting out all the interventions for moderate and high frailty individuals. And lastly, with remote care monitoring, as you know, last year and few years, Ontario Health has been promoting digital health at a scale. And so with that, Southlake Community OHT has developed partnership with Toronto Grace Health Center to monitor frail individuals, because frail individuals at their home, to monitor for falls, to monitor for wandering, and to monitor for medication compliance. And so due to the partnerships that we've had with CHATS, we've been able to identify individuals and refer them into the program, again, to avoid hospital admission so that they can be best supported at home with the home care supports, with the remote care monitoring, to increase the quality of life. And through this program, in a short while, within less than a quarter, we've had about 200 referrals go through. And when we did a patient satisfaction survey, again, a lot of patients, mostly their caregivers, have been very, very thankful for this program. And then lastly, with all of this, we would like to end with just talking about our experience to date, what has worked, what really needs improvement, and what could be our future together.
Thanks, Ami. So honestly, leading the way, we still need to pave our way and showcase what we do, how we do it, and how we can help them. We have to showcase our knowledge of services available and work together on how we're addressing ALC together, and that through a community navigation. In today's fast-paced healthcare environment, it's essential to stay on top with the right people around. So what works? The leadership. What has been working throughout this whole time is honestly key success is having the leadership support on trying new initiatives and being open to trying things. The ability to relieve systems pressure, working along partners side by side, building a trusting relationship amongst all partners with understanding our work and role that we play in ALC, and also building on successes with opportunities for expansion. What needs improvements? We still have a far way to see what the full potential is on how we can assist, and really having that buy-in on, from the hospital in different lenses on how we can support different initiatives, and really thinking outside the box. So we also are looking at, improvements for dedicated on quality improvement processes, the ability to test and fail quickly, because as we are trying new things, it's really being open to trying and realizing things may not work the way that we were thinking, but being able to pivot and try a different way. Creative ways for engagement and continuous engagement from leadership. What's in the future? Really continue breaking the silos in healthcare and working together as partners. Continue on building stronger working relationships. And at the same point, systems performance measurements with a lens of a value-based care. Next slide. So at this time, I really just want to thank everybody for the opportunity for myself and Ami to share what we've been doing as CHATS and the Southlake OHT. Our contact information is listed here if there are any further contacts or questions that anybody may have. So thank you.
All right, great. Thank you so much for sharing all of that information. We do have a couple of questions in the chat. One of them was from me. I think you guys have really covered it off. Around having any, I guess I was wondering if you had any learnings or tips, for folks who are really wanting to build those partnerships across sectors, but it sounds like you really touched on leadership as being that piece that really enabled you. I guess, was there anything else, any other learnings you'd want to share with the folks who are here today who are wanting to build something similar?
I think on my lens, it's really just being open and, having those conversations and realizing it's not going to happen overnight. It's going to take time from the frontline sector to leadership to make sure that we are at the tables. It's once we showcase what we do is really where there's the opportunity for us to grow, and just being patient as we, try to make our way into it.
great. Thank you so much. And we have a question from Lavinia. Must emergency patients consent to involvement in the ED rounds, or is it automatic that all elderly persons brought in to emerge for reasons that include social issues be discussed at rounds?
Yeah. So the ED rounds are in hospital meetings, so it's automatic in that sense that they're reviewing all patients to do at that time. Yeah.
Okay. All right, great. Thank you. We have another question from Lisa. Is there involvement from York Region at these ED rounds?
At this time, no, they're not partners.
Okay.
Yeah.
So maybe a potential
Yes,
potential
of course.
partnership.
So we are, on that note, we are looking at developing partnership with York Region homeless division to understand how to enable transitions of care for individuals who seek care due to homelessness at the hospital. So we are actively in talks with the York Region.
Okay. All right. Great. Thank you. We have another comment and question from Jennifer. Great presentation. You mentioned implementing senior-friendly practices in transition and discharge planning. How do you measure positive experiences of seniors or caregivers that have resulted from your program? Do you, in partnership with the hospital, HCCSS, et cetera, implement client and caregiver surveys?
So some of the programs that we have, like Southlake at Home, remote care monitoring, those are the programs where we actually measure client satisfaction on a very regular basis. We are not measuring client satisfaction per se for the ED rounds or complex discharge rounds because those are more care planning meetings. But during any implementation that is patient-facing, we are measuring those indicators. I must say, though, that we are also measuring provider satisfaction in those care planning meetings. And how does the provider feel? Are their opinions valued? Are they taken into consideration? Is the time valuable? All of those indicators we are measuring to understand how can we, improve our process. As Sony mentioned, there's a focus on a lot of quality improvement process. And if something's not working, we are trying to pivot as soon and as quickly as possible.
All right, great. Thank you so much for sharing all of your expertise and everything about this amazing program. So we thank you very much for your time. I don't see any other questions in the chat, but again, if you're on the Feedloop platform or here in Zoom, you can reach out to our presenters. I think what we'll do next is we'll take a short 5-minute break to let people stretch and get their coffee, and we'll come back for our final presentation. So thank you both so much for your time.